Okay, let's unpack this. We're jumping into a deep dive on a really complex condition in dogs today.
Who are?
We're pulling key info straight from some expert veterinary sources.
That's right.
Our mission, to get a solid, quick understanding of primary ciliary dyskinesia in dogs, canine PCD.
And it's fascinating stuff, really, how something so small on a cellular level can cause such big problems throughout the body.
Absolutely. It really highlights how crucial even the tiniest parts
Yeah.
are. So, let's get right into it. What exactly is primary ciliary dyskinesia?
Okay, so fundamentally, it's a congenital disorder.
Meaning they're born with it.
Exactly, born with it. The source material points to it being autosomal recessive, so it's tied up in their genetics.
And the main problem is with cilia, those tiny hairs we hear about.
Yeah, precisely. The cilia, think of them as microscopic sweepers.
Sweet.
Yeah, tiny hair-like things in the respiratory tract. Ears, brain ventricles, spinal canal, reproductive tracts, lots of places. Normally, they beat together rhythmically to move fluid like mucus along. They're constantly clearing things out.
But in dogs with PCD, that sweeping action doesn't work.
That's the issue. The text explains their beating is either abnormal, they call it dyskinetic, or just absent,
Yeah.
completely stopped.
Yeah.
So the sweepers aren't sweeping right, or, not at all.
And it's not just breathing problems. This is the material mentioned other things can happen too.
That's a really important point. Because cilia play a role in development across different systems, you can see other conditions pop up alongside PCD, things like hydrocephalus.
Fluid on the brain.
Right, and situs inversus.
Situs inversus, isn't that where the organs are, like flipped, heart on the right side, that sort of thing?
Exactly that. And here's something really interesting from this source material.
Yeah.
If you have a dog with chronic respiratory disease, and they also have situs inversus, their organs are mirrored, the text suggests that's almost certainly PCD. Yeah, it says you might not even need a lot more testing because that specific combination is such a strong indicator of the underlying issue.
That connection is pretty striking. Chronic breathing issues and flipped organs pointing to the same root cause.
It really underlines how vital these microscopic structures are, doesn't it? For so many bodily functions right from development. When they fail, the knock-on effects are huge.
Okay, so who tends to get this? And what does it actually look like in a dog?
Well, typically it's diagnosed in young dogs, often under 8 weeks old.
So puppies mostly.
Mostly. But, interestingly, some dogs can seem fine for ages. They might be subclinical, show hardly any signs until they're much older, sometimes, 6 months to even 10 years old.
Really? That late?
Yeah. And while it seems more common in purebreds, the text mentions Bichons and Old English sheepdogs specifically. It definitely shows up in mixed breeds too. And even, believe it or not, in cats sometimes.
Huh. Okay, so if an owner brings in a dog, what's the typical story the vet might hear?
You'd likely hear about long-term respiratory problems. Constant sneezing, maybe a runny nose, a cough that won't quit, getting tired easily during exercise.
Sounds rough.
Yeah, sometimes even episodes where they're really struggling to breathe. And here's a detail the test highlights, which is quite telling.
What's that?
These dogs often get dramatically better right after starting antibiotics.
Oh, good.
Well, yes, but then the symptoms come right back pretty quickly once the medication stops. That pattern is a big clue.
Okay. Not just a simple infection, then.
Exactly. And family history matters, too. Since it's genetic, you might find more than one pup in a litter affected. Oh, and the text also notes infertility in males as something you might hear about.
Got it. And what about the physical exam? What would a vet typically find?
Usually, discharge from both nostrils, often thick, like mucopurulent discharge. A productive cough is common.
Meaning they cough stuff up.
Yeah. And if they have a secondary infection flaring up, you might see fast breathing, real difficulty breathing, maybe even that bluish tint to the gums or skin cyanosis from lack of oxygen.
Okay.
Listening to the lungs, you'd probably hear increased sounds pretty much everywhere, though how loud can vary. And going back to that situs inversus ciliaris, if it's present, the heart sounds might actually be loudest on the right side. Or sometimes, if the pneumonia is really bad, the heart sounds can be hard to hear clearly at all.
So it really leans heavily towards those respiratory signs because the mucus isn't clearing. But that organ reversal thing is a constant reminder it's a deeper systemic issue.
You've got it. And the root cause, as the source material really stresses, is genetics. They've even found a specific recessive mutation in Old English sheepdogs, for instance.
And like with other recessive conditions, inbreeding would make it more likely?
Definitely increases the risk. Yeah.
So it's like the body's internal cleaning crew, the cilia, are just faulty from the start, leading to this buildup and all the secondary infections and problems.
That's a great way to think about it, yeah. The system meant to keep things clean just isn't working properly.
All right, so figuring out if it is PCD sounds like it could be tricky. With all those symptoms, how is it actually diagnosed, and what else could it be confused with?
Yeah, the diagnosis can be complex. There's a whole list of differential diagnoses, other things that cause similar chronic respiratory signs.
Like what?
Well, the text mentions other congenital problems, maybe issues with immune cells like neutrophil dysfunction or antibody deficiencies. Then there are acquired problems, things the dog wasn't born with,
Okay.
like canine distemper virus or recurrent aspiration pneumonia from inhaling stuff, chronic bacterial pneumonia, even weird things like a connection between the airway and esophagus, a bronchoesophageal fistula,
Wow, lots of possibilities.
and importantly, external factors too. Chronic cigarette smoke exposure, or certain infections like mycoplasma or bordetella. These can actually cause acquired ciliary defects. The cilia stop working properly because of the irritation or infection, not because of genetics. And that can look a lot like PCD, at least initially.
Okay, that's a key point. So how do you tell the difference between a lifelong genetic issue and something acquired, especially when, as you said, the PCD itself leads to chronic infections that could also cause acquired problems?
That's the challenge, isn't it? It raises that important question. Is the infection causing the cilia problem, or did the faulty cilia allow the chronic infections to take hold in the first place? It's why the diagnostic workup has several layers.
So what kind of lab tests do you start with?
You'd run the standard blood work, CBC, chemistry panel, and urinalysis.
Yeah.
These can show signs of chronic infection or inflammation, maybe high white blood cell counts, specifically neutrophils.
The infection fighters.
Right. Sometimes you see signs they're working really hard, immature forms, or toxic changes. Older dogs might have high globulin proteins. And if the dog's oxygen has been low for a long time, the body might try to compensate by making more red blood cells called polycythemia.
Anything more specific in the lab work?
Blood gas analysis is pretty important. It checks oxygen levels directly. You often find low oxygen, hypoxemia, but the carbon dioxide levels might be normal or even low.
Okay.
And collecting fluid from the airways, a bronchoalveolar lavage, or BAL, is really common.
Washing out the lungs a bit?
Sorta, yeah. You collect that fluid.
Yeah.
Typically, you find lots of mucus and pus bacteria often. And this text specifically says to request a culture for mycoplasma because of its link to those acquired ciliary issues.
Makes sense.
And here's a really neat diagnostic clue the text mentions, totally unrelated to breathing.
Oh.
Checking sperm motility in an intact male dog. If the sperm move normally, it pretty much rules out PCD.
No way. Why is that?
Because the tail of the sperm, the flagella, it's basically a modified cilium.
Yeah.
Same underlying structure, same machinery. If the sperm can't move properly, it points back to that fundamental ciliary defect.
That is fascinating. A very clever diagnostic link. What about imaging, like X-rays?
Chest x-rays, yeah. They can show typical signs of chronic bronchopneumonia. You might also see the cetus inversus, if it's there, or airways that look wider than normal. That's bronchiectasis, sometimes thickened bones in the middle ear, the tympanic bullae.
And isn't there a test that actually watches if the cilia are moving stuff?
Yes, exactly. Tracheal scintigraphy. It's a mucociliary clearance test.
How does that work?
They have the dog inhale a tiny amount of a radioactive tracer, and then they use imaging to track where it goes, or rather where it doesn't go. It's important to make sure there isn't an active infection or recent smoke exposure because those can temporarily slow things down. But in a dog with PCD, according to this text, that tracer essentially just sits there. It shows no movement away from the carina, the spot where the windpipe splits. The cilia just aren't clearing it out.
So you can literally see the system failing. Wow. But for the definitive answer, you really need to look at the cilia themselves, right? Up close.
That's considered the gold standard, yes. Electron microscopy.
Sounds complicated.
It is. You need tiny tissue samples with cilia, usually from the nose or airways. Then you look at their internal structure, their ultrastructure, under incredibly high magnification.
What are you looking for?
Specific defects. Things like the central microtubules being messed up, or missing dining arms, which are crucial motor components for the beating motion. The text clarifies an important point here. You need to see these defects in more than 20% of the cilia you examine to call it PCD.
Why the cutoff?
Because if it's less than 20%, it's more likely those are acquired defects, maybe damage from chronic infection, rather than the underlying genetic problem. But get this another complexity. Some dogs that definitely have PCD based on genetics don't show these structural problems on the electron microscope.
Seriously. So they
Yeah.
look normal but still don't work.
Exactly. For those cases, the diagnosis relies on even more specialized tests done in the lab, in vitro tests, that directly measure how fast the cilia beat and how coordinated, how synchronous that beating is.
So it's not always about a visible broken part. Sometimes it's just they don't function right.
Right.
What about pathology, if you examine the actual tissues?
Yeah, looking at the tissues shows the results of everything being stuck. In the nose and sinuses, you see chronic bacterial rhinitis, loads of mucus and pus, inflammation, swollen glands, maybe underdeveloped structures, blocked sinuses, even nasal stones sometimes.
And lower down, in the lungs.
Similar story. Airways filled with mucus and pus, bronchitis, bronchiectasis, those widened airways, again, areas where the lung is collapsed, called atelectasis, even little air pockets under the lung surface, subpleural emphysema.
And the other stuff.
You might see the hydrocephalus, the situs inversus organs, which could be just chest organs, just abdominal, or both situs inversus totalis, and another odd one. The middle ears can get clogged up with this sterile, jelly-like stuff because the cilia there aren't clearing things either.
Man, it really drives home how that one initial failing, the cilia not working, causes this cascade of problems everywhere because secretions just get trapped.
That's exactly it.
Okay. So since you can't actually fix the faulty cilia, how do you manage PCD? What's the approach?
Right. There's no cure for the underlying defect, so management is all about dealing with the consequences and helping the body cope.
How do you do that?
The text highlights a few key things. Routine exercise is actually encouraged.
Really? Even with breathing issues?
Yes, because the increased breathing depth and the coughing it stimulates can help physically clear some of that mucus. Of course, supplemental oxygen might be needed during really bad bouts of pneumonia, and airway physical therapy is crucial.
What does that involve?
Things like saline nebulization, having the dog breathe in a saline mist to help loosen secretions. And cooping. Yeah, it's a technique where you gently but firmly tap on the chest wall. It helps vibrate and mobilize the secretions so the dog can cough them up more easily.
Okay, that makes sense. What about medications? Antibiotics must play a big role.
Oh, absolutely essential.
Uh.
Treating those secondary bacterial infections is paramount. But, and this is critical, antibiotics should always be chosen based on culture and sensitivity testing.
To make sure you're using one that will actually kill the specific bacteria.
Precisely. And how long you treat depends on how severe the infection is. But here's a really important warning from the text. Using antibiotics continuously, like all the time, is not recommended.
Why not?
Because it massively increases the risk of breeding antibiotic-resistant bacteria in the airways. And if that happens, future infections become incredibly difficult, maybe even impossible to treat.
Right, you don't want to create superbugs. Are there any meds you should definitely avoid?
Yes, cough suppressants are a big no.
Yeah.
You want the dog to cough.
Because that's how they clear the gunk.
Exactly. Suppressing the cough traps all those secretions, making the inflammation and infection worse.
Got it. What about anesthesia? Is that riskier for these dogs?
The text points out that yes, it is. Because of their chronic lung disease, their ability to exchange gases is impaired. So there's definitely an increased anesthetic risk. You need to be careful to minimize respiratory depression and ensure they recover smoothly.
Makes sense. Looking long-term, what are some potential complications owners need to be aware of?
Well, that chronic infection and inflammation can weaken the lung tissue. You can get air pockets or cysts forming, called bullae, which can rupture and cause a collapsed lung, a pneumothorax.
Scary.
Yeah. And the chronic low oxygen puts a major strain on the heart over time. This can lead to high blood pressure in the lung arteries, pulmonary hypertension changes in the heart itself, called cor pulmonale, and eventually right-sided heart failure. Also, persistent bacterial infections can sometimes trigger a body-wide inflammatory condition called systemic reactive amyloidosis. It's just a ripple effect from that initial ciliary problem.
So managing PCD is really about constantly managing those secondary problems. What's the overall outlook? The prognosis?
It's highly variable, honestly. The text says the clinical course and lifespan can differ quite a bit from dog to dog. Interestingly, it also mentions some dogs might actually seem to improve or become subclinical, show fewer symptoms as they get older.
Huh. Any idea why?
The text doesn't elaborate, but maybe their immune system adapts or management gets really dialed in. But the key takeaway is that with diligent management, prompt antibiotic treatment for infections based on cultures, plus consistent pulmonary physical therapy like exercise, nebulization, coopage, The text states that prolonged survival is definitely achievable for many of these dogs.
So no cure for the root cause, but managing the fallout, the infections, the mucus buildup can really make a big difference in their quality of life and how long they live.
That's the essence of it, yes. Supporting the body where its own natural clearing system has failed.
Well, this deep dive has certainly given us a really thorough look at a complex condition. We've unpacked what canine PCD actually is, starting from that tiny cellular problem. We've talked about who gets it, the signs to watch for, the pretty intricate diagnostic process involving everything from basic labs to high-tech microscopy.
And even sperm motility.
Right. And finally, how it's managed day to day, the potential bumps down the road, and the fact that the prognosis can vary so much. You, the listener, have gotten a fast but detailed overview straight from the veterinary literature, really showing how these microscopic issues have huge impacts and need careful, ongoing attention.
It really is fascinating, isn't it? How much you can understand about such a complicated disorder by connecting those dots to genetics, cellular mechanics, and then seeing how that plays out across the whole animal.
Absolutely makes you appreciate how interconnected everything is, even systems we barely think about. Which leaves us with something to ponder. Given that PCD is genetic but has such a variable outcome, what does that tell us about that interplay between our genes, environmental triggers like infections, and how we approach long-term health management in our animals? Or maybe just think about this. How utterly essential are these tiny microscopic systems like cilia for just basic everyday well-being, something we definitely take for granted until they go wrong?